Welcome back all from our break. I'm Rebecca Kirch, Executive Vice President of Policy and Programs for the National Patient Advocate Foundation. And here I'm joined by colleagues that I'll introduce in just a moment to get into a quite lively discussion about the nitty-gritty of what needs navigation looks like, the opportunities it has, and I think importantly for all of us in that spirit of call to action that Gwen talked about, the opportunity we all have to take steps to bring disparities to a halt as we think about what real social justice means. I loved Dr. Nguyen's presentation, as we all did, but in particular, his slide about healthcare should be the next major social justice movement. I think there's no better place to think about the opportunity for building that, igniting that movement than thinking about public policy. So that's the focus of our panel today. And I think this comes from the heart of all of us who are collected together on this call, and thank you for joining us. But the panelists that we've assembled here for this session bring such a wealth of real world experience and expertise in the thick and thicket of what needs navigation should and must be, and preserving financial wealth. So we've drawn on the expertise of three panelists that I'll introduce here to get us started. First, Billie Allard, who is a nurse executive and a real spark plug out there building programs in communities, Billie, to help patients and families get the care and their needs met that often go overlooked. So you've written a book on the value-based care coordination. You're a real fireball, spearheading this new initiative that the Academy of Oncology's Nurse and Patient Navigators has launched this very week. So it's hot off the press. And I think there's a great deal of this new initiative focused on, where you're the clinical leader, that's focused on boosting growth of nurse navigation to stretch across different diseases. So give everybody a wave, Billie, before I introduce Michele. Welcome, welcome. Michele, you are Senior Director of Healthcare Solutions at the Financial Health Network. And I'm so thrilled to bring you to this particular conversation because you're a bit in the outskirts of what health systems do, but working directly as a healthcare solutions strategic staffer to make health systems understand the opportunities we have to preserve people's financial wealth. So that opportunity you have for working at that intersection of health equity and financial health is just a very valuable perspective that comes more from the business side of financial wellness instead of the, as Gwen said, the disjointed financial system, and Meg Gaines echoed that chorus about the disjointed health system we have, but the opportunities that you can share with us around care delivery, health services research, and health policy that you bring to the role in terms of financial well-being and wellness. And then finally, Becky Shipp, who has been a longtime policy advisor to me and to many in the spirit of helping advance needs navigation. Becky brings to this discussion many, many years of Senate Finance Committee staffing work at the helm, really seeing through major legislative changes over the years for children, for families, for promoting healthcare. And so collectively together, I'm really excited about this conversation because we have the chance to dig a bit deeper in talking about the experience, impact, and prevalence of what social needs are and the distresses that patients and families coping with complex chronic conditions are coping with, but also the opportunity to talk about the real world experience of how needs navigation and financial health and wellness support can bring to that table. And finally, really identifying those policy approaches that will help take us to the next level. So without further ado, if we think in the back of our minds, or really top of mind of what Dr. Nguyen said about healthcare being the next major social justice movement and the opportunity for programs and policy change to make it so, I'd love to open up the discussion first with Billie, the nurse on the ground who's been in many communities doing the kind of needs navigation that we've been talking about the need for and the opportunity for years. You've had so much experience in many different settings that you can share with us a bit, building these different successful programs that provide navigation services on the ground. Can you talk first a bit, just to paint the picture for our listeners, about those real life consequences for patients, caregivers, and families when they don't have access to financial and social supports?
You know, I would say that the most important one that I see is they try to avoid healthcare. They try to not use resources because they're ashamed that they don't have financial resources. So it ends up turning into mothers who are pregnant choosing not to get prenatal care in a timely manner, and then that has consequences. We have seen a huge issue with newborns not getting the screening and the care that they need for that first year of life. And some families choose to then not see a pediatrician, but seek care at urgent care sporadically without having their growth and development monitored, without getting connected with the resources that are really going to help them grow into healthy children going forward. You know, just the pain and agony that we see in the pediatric office, where the pediatricians say to us, help us with social needs. We can't take care of families because there's so many things standing in the way of their health. You know, they don't have food, they don't have housing, they don't have any of the necessities of life that they need. And that goes across the whole health across every age. We see a lot of elderly folks, once they get retired and they're on a fixed income, they may be seeking medical care, but suddenly they have all these medications and they have to choose between, do I have food or do I have medications? And they're afraid to tell the truth about that because they're afraid someone will put them in a nursing home. We see young adults that suddenly don't have care and they're putting off getting treated for illnesses, getting treated for injuries that end up causing long-term effects that then cost healthcare more dollars. And so it really is a crisis. And it's a crisis that, as a nurse, wasn't top of our education years ago. We didn't talk about social determinants of health. And frankly, as a nurse for many years, we missed the boat. Because if we don't take care of the social determinants, if they don't have food, housing, if they don't have the necessities of life, of course, they're not going to be healthy and they're not going to be able to manage chronic disease. They're not going to be able to be equal members of our community. And so, you know, the work I've done for the past decade, I'm on a mission to change that. And so I agree that this is the time now. We've seen it with COVID. We've seen it right in our face every single day. So now is the time that we have to make it better. And I'm so happy to be here to be part of this discussion.
Thank you so much, Billie, and especially for the innovation that you and the Academy of Oncology Nurse Navigators have brought to the table. I think it is an exciting time. And I wonder, if, Michele, let's turn to you to talk a little bit about what you see about the timing and now from the perspective of your perch with Financial Health Network and your earlier experience in community health centers.
Sure. So I think, so my earlier experience with community health centers was when healthcare itself was trying to take on greater acknowledgement of social risks that were occurring before patients actually came to healthcare. What are those factors that were really driving and behind those poor outcomes and even higher costs? But these were the measures that healthcare providers were being held accountable for. So what is it they could do to take on a greater role to understand and address these factors? And in doing so, community health centers wanted to think about, well, it's not just about measuring those concerns, but also how do we demonstrate the role that we play in managing these complex issues too, I think with COVID right now, as people were delaying care and now coming back to care and having a lot of pent-up needs, it's really time to start thinking about these issues more broadly. We're looking at medical debt right now. I think there's a lot we can say about what the healthcare system is doing to understand social risks. And medical debt, though, it's something that the healthcare system might be causing, right? It is a social term in itself, and might be driven and caused by the healthcare system and the way people experience the healthcare system, unlike other social determinants of health. We're very much focused on medical debt as a key issue that might be keeping people from, in fact, we know it's keeping people from receiving the care they need. It's also worsening health outcomes. Just to tack on to what Billie was saying, right now, more than 1 in 6 people nationally are experiencing medical debt. It is the most common type of consumer need. It's disproportionately affecting people of color, people who experience disabilities, people with lower incomes, obviously impacting people without insurance, but increasingly it's also impacting people with insurance, given that so many more people are experiencing high out-of-pocket costs that may not protect them, or often does not protect them from the medical bills they accrue when they need care. We know that medical debt can happen in very small amounts, typically between $400 and $800, most people with medical debt have. And yet that is enough to cause financial ruin for families and people. Not only does it become the #1 driver of bankruptcy, it also impacts ability to save, pay for education, ability to get a loan, because it impacts their credit score. So it's impacting their ability to gain wealth over the long term. It's also forcing trade-offs between their daily needs, food and rent, and the need to pay for a medical bill. We also know that medical debt, just like financial hardship in general, as Billie said, is causing people to forego care when they need it. It worsens health outcomes, particularly worsening outcomes and for mental health. It also worsens mortality risk as well. But it can be prevented. This is the role the healthcare system needs to understand and play. There are a lot of things that the healthcare system needs to do to understand how this happens and work to resolve it. So, for example, we need to look at charity care programs and eligibility for charity care programs. We should be looking at flexible financing options. How do we make financing, the terms of financing, more beneficial and more suitable for people who struggle on a day-to-day basis? And of course, how do we help people navigate those out-of-pocket costs and expenses and understand ways to lower those out-of-pocket costs? And how do we give patients the tools they need to make informed decisions? How do we leverage price transparency rules that are out there right now for hospitals? And how do we make sure that cost of care conversations are happening at the point of care so that conversations around treatment happen simultaneous to cost of care conversations? And of course, these are all things that can be enhanced by financial needs navigation.
Thank you so much, Michele. I'm really struck in particular by your points about the skilled communication that needs to happen to draw patients out to talk about their unmet needs that are oftentimes their greatest worry, right? That's something Billie touched on as well, and yet often overlooked. Financial and social distressors are typically the last thing, if mentioned or asked about at all, for a host of reasons that we've heard about today and have experienced on our own in a busy clinical setting where there's so much to make happen. Billie, I'd love to turn briefly to this initiative that AONN and you have announced this week to bring the wealth of experience of nurse navigation into the broader chronic and complex care world. Can you tell a little bit about what the initiative is and the mission you have as a solution to these problems we've surfaced here?
Sure. You know, I think for decades, oncology nurses have navigated their patients. That's been a job, an oncology nurse navigator, and that has really helped them to connect that patient population with resources in a timely manner to help improve the outcomes and really support that person through the journey. And so within the last 5 years, 10 years, more and more little pockets of nurses across the country have said, hey, we've got to look at the oncology nurses and try to replicate that. So some of us have been working on this over the last decade, and now we're coming together with the help of the Links group to put together an association. And we're finding nurse navigators from across the country. We are, in fact, this Friday going to be announcing the creation of an association of chronic and complex care nurse navigators. And we really want to get the word out there because this is a successful strategy. This work helps us to uncover the issues, to connect people with the right resources, and to really help them to get their needs met. We partner with them individually. We build a relationship so they tell us the truth. And that over time transforms care and really changes outcomes. I think also, and we're going to hear this from our last speaker, there's opportunities where the payment system is shifting. And so that outcomes of care and cost are becoming more important. So this is a major window of opportunity. And we hope this new association, we will be leading the way across the country to encourage everyone to consider nurse navigators to really help with this health inequity. And it can be a game changer, and it has been for my community.
That's wonderful, and congratulations on this new next oomph. I think it's a sign of the times that,
Yes.
that we're in the place now where it's all hands on deck, and the opportunity to really influence change from many different walks of different fields coming together. And that's where I'm particularly thrilled to have Michele at our table today, because it's again, a newer, innovative place for us to be thinking about. Those of us in the health system who've been at this for years, together with the Financial Health Network, imagine the real mission work, shared mission work that can happen. Michele, will you highlight some of the Financial Health Network recent reports, resources, tidbits you want to share with this group about the solutions that you see that you can bring to this momentum?
Sure. So one of the things that we're working on right now will be released early next year is a series of reports around medical debt, right? To make the case that medical debt really is a social determinant of health, as I explained, because it impacts ability to seek care, receive care, and outcomes, not to mention it can cause a downward spiral in financial ruin as well. And those reports will provide concrete action steps that hospitals and health systems, employers as providers of insurance, as well as insurers can take to help mitigate and reduce and prevent medical debt as well. So we're very excited about those. We also have a series of consumer reports really tracking people's financial health nationally. So financial health is a pretty broad term to look at how people are spending, saving, borrowing, and planning in ways that enable them to be resilient, particularly in the face of unexpected expenses, such as a medical bill, and thrive financially in the long term. So we look at it as a very asset-driven upstream way that we can break the cycle of poverty. And our own data finds that 34% of people in the US are financially healthy, 14% are financially vulnerable. But what's often forgotten about is those 15% of people who are financially coping. And so on our website, I think there's a link that's going to be put in the chat. We have a lot of resources out there that look at financial health nationally, but also at the intersections of what financial health means for the ability to receive care, to avoid delaying care, right, and to take on debt. So I encourage folks to look at that. We had a report come out just yesterday that found that the child tax credit actually helped families pay for not just food and other necessities, but also healthcare as well. And also I encourage folks to look at the Financial Health Network itself as a resource working with health system players and finding solutions and strategies to improve the financial health of the people they're serving.
Thank you so much, Michele. I'm encouraged to hear about the the new association for chronic and complex nurse navigators, together with Financial Health Network, what we know about what Patient Advocate Foundation direct services do. And I'll turn to you, Becky, because you've been immersed in the needs navigation world for a short while since becoming a partner with me on this policy adventure. Can you talk a bit about tying together what you've heard here with the opportunities we have to ignite this movement in the public policy space based on your years of experience and the enthusiasm I know that you share?
Absolutely. Thank you, Rebecca, and thank you all for the opportunity to be here today. I worked on Capitol Hill for over 20 years, much of that time spent on the Senate Finance Committee, which has jurisdiction over the Medicare, the Medicaid, and the Children's Health Insurance programs. A little known secret about Congress is they don't know what they don't know. When I was on the Hill, I never heard about the need for social and financial needs navigation to address medical debt and improve social determinants of health, much less issues around equity. In the time I've spent off the Hill, I've reached out to my former colleagues, and they are also unaware of this critical and compelling need. But that's not to say they don't recognize that there are access and affordability issues. It's just the prevailing view is that through insurance reform, many of these have been addressed. Our mission is to socialize and emphasize the fact that if a patient doesn't realize how to figure out what these protections are and how to utilize them, they aren't worth very much. In terms of social and financial needs navigations, I'm going to date myself a little here. The Hill is kind of like the Maytag repairman, sitting around waiting to be called. We need to be calling on him. What we need to do is to work to ensure that needs navigation is an integral part of our healthcare delivery and financing systems. Too often, access to these critical services is just luck of the draw for patients and their families. As we've heard, many are left out in the cold with no one to guide them through the difficult and complicated myriad of issues and challenges resulting from a diagnosis. The way through that is to influence and inform public policy through informed strategic action. The good news is there is an opportunity through health equity to highlight needs navigation. The better news is we don't have to recreate the wheel to begin making progress. We've identified a number of existing federally funded programs that, with a little tweak, can be expanded to capture issues associated with improving social and financial needs navigation. Briefly, these include the Temporary Assistance for Needy Families program, the Social Services Block Grant, and programs through Medicaid, such as targeted case management. Fortunately, these are all programs within the jurisdiction of the Senate Finance Committee, which is part of our advocacy strategy. We are focusing on that committee. With your help, with the help of everybody here today, and through events such as this important policy consortium, NPIF and our partners are poised to pounce in terms of bringing our message to the Hill. But your work, your voice, your expertise, your data, your analysis will be instrumental in moving us forward. I thank you for the opportunity to share these views, and I'm happy to continue to answer questions and be a part of this important discussion.
Thank you so much, Becky, Billie, and Michele. I think what we can take from here is certainly the collective energy that we want to bring forward in recognizing from this consortium today and all the different discussions, the documentaries, the podcast insights, that navigation, this needs navigation, is really a health equity lifeline that we all have a job to help explain to different audiences how we can use these services that have been proven in multiple settings in different ways to mitigate these financial and social distressors that really impact, as Michele, you highlighted, people's health outcomes, their ability to live well, live financially stable lives, and help to address the disparities that we are all very committed to overcoming. So what I'd like to do is thank the panelists very much and turn it to my colleague, Nicole, who I believe is going to be moderating questions. Should you have any, you can drop them in the chat. And as well, we will put some resources for you all, both in the chat and the follow-up communication to this, some of the reports that Michele mentioned and some needs navigation resources from us, and anything, Billie, that you want to share. We'll be sure to send those around in follow-up as well as in the chat. Thank you. Nicole?
Great. Thank you, Rebecca. Hi, everyone. I'm Nicole Braccio, the Policy Director at Npif. And I just wanted to point out a comment that someone left in the chat from Kristen, who I think in response to Billie's experience being a navigator says, couldn't agree more. My oncology nurse was invaluable in the support she provided during my cancer experience. So I think, you know, you all have gave some great examples of when it works well, when people have the supports of a navigator, you know, what a great, you know, how that can really help to improve health outcomes and navigate people to supports and services. But for, you know, all of the other people out there who, you know, were not lucky enough to have that connection, you know, I think that's where our work here really is focused on. So I don't see any questions in the chat. So folks, please don't be shy. We, our wonderful panel here would be happy to answer any of your questions. And to get started, I can maybe just build off of where we left off. So I know Becky and, you know, everyone kind of shared Npif being poised to pounce, you know, kind of the stars are aligning in terms of different professionals in the field who are coming together to work on this issue, especially having someone from like Michele from the financial health space, as well as folks in the clinical space to really put the great minds together and think through how to make this a scalable solution. But I'm wondering if maybe, you know, each of you or whoever wants to go first to talk a little bit about what do you see are like the major barriers in, you know, advancing this ambitious agenda, whether it's from Becky, the policy perspective, you know, how do we get Congress to really care about this enough to take action on it, as well as, you know, from the financial health or the clinical perspective, what are the barriers to making this something that's, you know, scalable and available to as many people as possible?
I guess I could speak a little bit about some of the successful programs that we have had, specifically with mental health and substance abuse disorders. That patient population wasn't having their needs met, and we ended up putting a patient advocate in the emergency department that immediately partnered with patients coming in that traditionally were getting medical workups. They were coming in saying they had chest pain or a headache and getting an expensive medical workup because they wanted food, they wanted shelter, and they wanted caring. And since we turned that around with the patient advocate, we have a whole team of community care team members from agencies across our community that meet on a weekly basis. And we have permission from those patients to put together a care plan for them. And so that population that was coming to the emergency department with workups that they didn't really need are now getting connected with the right resources. We've had a 50% reduction in emergency department visits, but more importantly, we've transformed their lives and gotten them on the right track. So it's almost so many of the programs, it takes a community. The time in the hospital is short. What we need is everybody to come together and come up with a longitudinal plan of care for chronic disease, for complex care, for mental health. And, you know, the resources are there. We've got to bring them to the table and come up with a plan that works.
And from my perspective, there's a lack of understanding what financial health is in the healthcare sector. Healthcare sector spends a lot of time thinking about and working to address social determinants. But when it comes to financial health, they tend to be more focused on financial strain. So the ability to pay for immediate needs like food and housing or your healthcare, right? Can you afford to pay for the healthcare that we need to provide you or your prescriptions? And I think they also need a better understanding of the ways in which medical debt is happening and how it accrues. But they also need help understanding what the appropriate and workable interventions are, particularly to meet the specific needs and circumstances of the patients and communities they're serving, and how to build those cross-sector partnerships. I think healthcare in general has made a lot of progress in building cross-sector partners with community-based services and social services. Many of them are still being worked out, but partnerships with financial services and repayment options, these are things that might be a little newer, especially as we think about financial health more broadly to account for the ability to build wealth as well. So I think that's new. And I also think the healthcare sector needs, they want to know what works, right? So it's not just what intervention should we try, but how do we demonstrate the impact? How do we understand the value it's bringing to us and our payers as well as our patients? And is there a business case to be made to further incentivize work in financial health?
We find a lot of patients could have resources, could have coverage, and they don't even know about it. So having financial counselors available in all of the settings and connecting them, a lot of times there is resources that they could be using and they have no idea. So I think that's so important, Michele.
So building off of what Billie and Michele have said from a federal standpoint, the challenges, as was touched on, are the cost to expand these needs navigation services, or as Alan called them, precision navigation, which I really liked. Will have with it associated costs. I believe the theory of the case is that these types of services can reduce costs ultimately. One of the things that we've heard is that, people delay or deny themselves care and treatment for fear of financial implications. That affects costs. There's oftentimes duplication in services that can be better managed through navigation. And as Billie just mentioned, there are probably resources available to mitigate some of these costs that patients are completely unaware of. So our challenge in moving forward is to standardize what we mean by financial and social needs navigation, and then build the substantive case that, that rather than, costing more ultimately in terms of well-being and even, federal financing implications, this can ultimately be a tool to reduce healthcare costs overall.
Great. And just to recap the answers you all gave, it sounds like, so the challenges and the barriers we're looking at are the time and data on what works well, so that we can standardize these processes, tackling how to even form these effective partnerships, and costs to expand the services themselves if the federal government is going to be picking up the tab on that. So there's a bunch of other questions in the chat. One here is asking about, are there any current legislative initiatives or parts of maybe the Build Back Better plan or others that any of you are particularly excited about?
Well, I think, I think there's been a lot of, work done to expand Medicaid coverage for underserved populations, to give states that have not picked up the opportunity to do so. But I also like the point that Michele made about the child tax credit, which has been, demonstrated to reduce child poverty and can be used to, to address healthcare costs. I think that's, incredibly exciting. But the devil's in the details, and like everybody, we're anxiously waiting to see what emerges. But I do think that there is a move to improve access, and we can certainly build on that moving forward.
I'll just add too, we're also very much looking forward to seeing what comes out of legislative proposals to expand access to health insurance. One thing we're also tracking at the Financial Health Network that you'll see in our pending reports is looking at price transparency rules and how those will be enforced. We know that price transparency alone is not enough to help inform patients and help them understand their decisions. It really needs to be paired with financial navigation, but it's something that we're looking to roll out. At this point, the law is already passed and it's in the regulatory process.
And I think it would be great if somehow doctors were incentivized for outcomes and not volume. And, you know, the way the payer system has been, outcomes has not been a piece of it. Health equity has not been a piece of it. And I think if we incentivized health systems to begin to transform care to better meet the needs of our communities, I think that could really put the money where it's going to make a difference across our country.
Great, thank you all. We have another question from Wanda. Thinking about Dr. Wynn's presentation earlier about the Faith on Friday program that he introduced, can you maybe talk about some of the merits or whether it would be feasible to integrate a nurse navigator within a program like that? So I think that was where, it was more community focused, looking at sort of church groups as a community leader.
I really think that they could be anywhere. I think we have people in our community that want to help, but they don't really know what to do. So I think it could be in schools, it could be in churches, it really could be anywhere. Retired professionals that were nurses or financial counselors or social workers could be helping in their community. And each of those locations are where the people are. So I think that's a great strategy. And I think there's a lot of people in our country that would love to be more helpful, but don't really know how to do it. So I think that's a great idea and has merit. And I'd be happy to begin to do that in my community.
It's wonderful. And you said the magic words, which is meeting people where they are. I think that is certainly key to, a successful program that's built on trust.
Yeah.
So thank you for that. Okay, there's another question regarding health systems or clinics who would like to begin integrating financial and social needs navigation services. Are there any resources available to help them get started if they know they want to do this, but they just don't know where to start?
I think just from my perspective, most of the programs we started, we looked for grant funding. And we're able to demonstrate results from the work that we did. And then we could go and get the funding a different way once we could prove that it was working. I think there are a lot of grants available right now for work like this. And that is like the seed money to really get started with it. So that was our strategy.
Great. Well, thank you all so much for your time and your insights. We are at time now and have to wrap up and move on to our next segment, which is a podcast excerpt. So I want to thank everyone in the audience for your great questions, and to the speakers. There are some more comments in the chat that you may want to look at regarding your presentations. And again, thank you all for an insightful discussion, and I look forward to seeing you all again later.
Thanks.
Thank you.